Once again, welcome back to one of the video of obstetrics and gynecology. Today we are going to see the very basic concept of OBG, that is anatomy and physiology of female reproductive system. If we are looking into the anatomy and physiology of female reproductive system, we can identify that it is designed specially for certain important functions. In that one is it maintains the normal pH of the vagina. The normal pH of the vagina is 4 and it carries and maintains the normal 40th week of gestation. That is, it supports, maintains the 40th week of pregnancy. The normal duration of pregnancy is 40 weeks. The reproductive system supports, maintains and even helps for it achieves the delivery of the baby. And it releases around 400 oocytes between menarche and menopause. Menarche means we know that it is the attainment of menstruation, that is onset of first menstruation, and menopause is the stoppage of menstruation. In between this menarche and menopause, every month alternatively or both ovaries release around 400 ovums or oocytes. And if you are looking into the ovary, at the time of puberty, it contains around 4 lakhs oocytes. But out of that 4 lakhs, only 400 only will be releasing as secondary oocytes or ova. And it supports and maintains the normal 28 day of menstrual cycle and 280 days in a normal period of menstruation. During that period, the females are not getting menstruation. So all these processes, this female reproductive system is maintaining and it is carrying out beautifully. And now let us see the important functions of the female reproductive system. One is it is producing the ova, that is female gametes, and it receives the sperm and it provides a suitable environment for the fertilization, that is fusion of ovum and sperm, and it provides a suitable environment for the development of the baby, and it helps for the parturition, that is for the childbirth. It supports lactation, production of breast milk, and it provides complete nourishment for the baby in the earlier 6 months of life. If you are looking into the anatomy of the female reproductive system, we can see that it is divided into external genitalia and internal genitalia, and it includes accessory organs of reproduction also. Now let us see this external, internal genitalia and accessory organs of reproduction. The external genitalia or vulva, it contains mons pubis. It contains mons pubis. This area is the mons pubis, and it contains clitoris, vestibule, anus, labia majora, labia minora. This is labia majora. This is labia minora. This complete structure is labia minora. And this is urethral orifice, this is vaginal orifice, and the sides of the vaginal orifice, it contains a ruptured hymen also. And it's having the opening of the, here you can see two sides, it's having the opening of the greater vestibular glands. Now let us see about these structures, that is structures of the external genitalia. The function of the external female reproductive structures includes, it enables the sperm to enter into the body, and it protects the internal organs from infectious organisms. Already I have told you that the vagina maintains the normal pH as 4, and it helps the inversion, or it gives protection against the invasion of microorganisms from outside into the body. The function of internal female reproductive organs includes, it's a pathway of the genital tract. The pathway consists of the following functions. The vagina, it's a part of birth canal where sperm are deposited and from which baby can emerge. Uterus, where embryo can develop into a fetus, and fallopian tubes, where a sperm and ovum get fertilized, or the union of sperm and ovum is occurring in the fallopian tube, and ovaries produces eggs every month or ovum every month. So overall functions of the external and internal genital organs we have seen. Now let us move into the details of anatomy of the external and internal structures. Once again, I will list down the external and internal structures. The external structures include mons pubis, labia majora, labia minora, clitoris, vestibule, urethral opening, vaginal orifice and hymen. Bartholin's gland, Skene's gland, and vestibular bulbs. The internal structures include vagina, uterus, fallopian tubes, and ovaries. Now let us see the external genital organs. We have seen the first one was mons pubis. It's a region of adipose tissue above the vagina and it is covered with hair. That is, it is a fat tissue cells deposition that is known as mons pubis, or it is otherwise known as mons veneris. And next is labia. That is, labia majora is there, labia minora is also there. These are rich nerve endings. This contains rich nerve endings and blood vessels. It protects the internal organs against the pathogens and it functions in sexual arousal also. Labia majora, these are two folds of adipose tissue that border each side of the vagina. Each side of the vagina is covered and protected by this labia majora. The labia majora encloses and protects the other external reproductive organs, including vagina, urethra, Bartholin's glands. Everything is inside, or it is enclosed inside this labia majora. And it is otherwise known as a large lips. The labia majora is relatively large and fleshy, and it contains sebaceous glands. And after the puberty, labia majora will be covered with the hair. Now, if you are looking into the internal aspects of the labia majora, we can see the minor small folds that is known as the labia minora. It's a smaller folds of skin that lies inside the labia majora. It's not having hair follicles or sweat glands. The fold contains connective tissue, numerous sebaceous glands, erectile muscle fibers, and numerous vessels and nerve endings. And it surrounds the vaginal opening and the urethra, and it protects these organs. And next is clitoris. It's a small cylindrical erectile body. It is measuring about 1.5 to 2 centimeter. It is situated in the most anterior part of the vulva, that is at the top. The two labia minora meets at the clitoris. It's a small sensitive protrusion. The clitoris is covered by a fold of skin. It is called prepuce. It is richly supplied with the nerves, and the clitoris it's very sensitive and it plays a major role in the sexual stimulation, and it can become erect also. Next is vestibule. Vestibule is formed by the labia minora. It encloses the urethral opening, vaginal orifice, and hymen. Ducts from the greater vestibular glands also, that portion. Next is urethral opening. It is situated in the midline just in front of the vaginal orifice. That is, if you are looking into that picture, if you are thinking about that picture, we can see that at the top urethral opening is there, middle vagina is there, and round rectum is there. It is about 1 to 1.5 centimeters from the pubic arch. And next is vaginal orifice and hymen. Lie in the posterior end of the vestibule. It completely enclosed by a septum of mucous membrane called hymen. And hymen is located just inside the vaginal opening. Actually, the hymen is not having any particular function, and sometimes it might not be even present also. And next is ducts from the greater vestibular glands and Bartholin's glands. You can see there are two Bartholin's glands, one on each side of the vagina. Each gland has a duct which measures about 2 centimeter and open into the vestibule outside. It close to the posterior end of the vestibular bulb. During the sexual excitement, it secretes excessive amount of alkaline mucus, and it helps, it gives lubrication for the external genital organs. Next, Skene's gland. These are the paraurethral glands. Next, we can see the blood supply to this external genital organs. The arterial supply is by the internal pudendal artery and from the branch of femoral artery. The venous drainage is by the internal pudendal vein and vesicle or vaginal venous plexus and from the long saphenous vein. A nerve supply, bilateral somatic nerve, anterior superior part is supplied by the cutaneous branch from ilioinguinal vein, inguinal nerve, and genital branch from the genitofemoral nerve, and posterior inferior part is supplied by the pudendal branch from the posterior cutaneous nerve. And the lymphatic drainage is by the superficial inguinal nodes, or it is into the superficial inguinal nodes, and intermediate groups of inguinal lymph nodes, external and internal iliac lymph nodes are also draining that or taking part in the lymphatic drainage. Internal genital organs. Now we are moving to the internal genital organs. In that, first one is vagina. It is otherwise known as birth canal. Directly from the external, we are entering into the internal. In the internal genital organs, so the first part is vagina. It's a tube-like muscular elastic organ, and it is about 4 to 5 inch long in adult woman, and its pH is acidic and it is 4, and it prevents it gives protection against the microorganisms, and it's a passageway for the sperm, and it allows the escape of the menstrual fluid, and during the time of delivery it allows the passage of the baby, and it's a organ of copulation and form as a birth canal, that is, it allows the passage of baby also. Now in this picture you can see that this violet color, this area is the vagina, this portion is the external genital organs, and from here directly it's the vagina. And posterior wall of the vagina is around 10 cm long, anterior wall is only 7.5 cm length. The upper end of the vagina is known as the vault. It is pink in color, and it connects with the external genital organs and to the uterus also. Inferiorly external genital organs, superiorly cervix and uterus is there, and it's an organ of sexual intercourse for the woman. And next we can see the fornices of the vagina, formed at the top of the vagina due to projection of the uterine cervix. 4 fornices are there, one anterior, one posterior, and 2 lateral. One anterior is in front of the cervix, posterior is behind, and lateral on either side of the cervix. Next we can see the relations or nearby structures of the vagina. Anterior to the vagina, bladder is there, and the urethra is also there, and which are closely connected to the anterior vaginal wall, bladder and urethra. And posterior to this, pouch of Douglas is there, rectum, perineal body, and each occupying 1/3 of the posterior vaginal wall, mainly rectum and Douglas pouch. Laterally, on the upper 2/3 are pelvic fascia and the ureters, which pass beside the cervix. And superior to the vagina, cervix and uterus is there. Inferior to the vagina, external genitalia is there. So these are the structures which are present around the vagina. And blood supply to the vagina is from the cervico-vaginal branch of the uterine artery. Vaginal artery, anterior division, it's an anterior division of the internal iliac artery, and internal pudendal artery also is supplying. And venous drainage is from the internal iliac vein and internal pudendal vein. Lymphatic drainage is by the internal iliac group and superficial inguinal group. Next, nerve supply. It is by the sympathetic and parasympathetic plexus from the pelvic plexus. Lower part is supplied by the pudendal nerve. Now we can move to the uterus. See, just above the vagina, this pear-shaped organ, this is the uterus. And if you are looking into the position, we can see that it is not in an erect position. It is slightly anteverted or anti-flexed. And this is the bladder. So it is in a position as like it is leaning over the bladder. See. The uterus is a thick-walled muscular pear-shaped organ. It is located in the middle of the pelvis, behind the bladder and in front of the rectum. The uterus is anchored in position by several ligaments. The uterus consists of the cervix and the body also. The cervix is the lower part of the uterus which protrudes into the upper part of the vagina, and it can seen during the pelvic examination. Like vagina, cervix is lined with a mucous membrane, but the mucous membrane of the cervix is smooth. Sperm is entering into the vagina and into the cervix, and the menstrual fluid exits from the uterus through the cervix and later it comes to the vagina. Usually in the normal condition, the cervix will be fully closed and it prevents the entry of microorganisms into the uterus and it protects the uterus. But during the time of labor, the cervix will get dilated and it will dilate up to 10 centimeter and it allows the passage of the baby. And during the menstruation also, it will allow the passage of the menstrual fluid. The functions of the main functions of the uterus include sustain a developing fetus and prepare the possibility for each month, that is that menstrual cycle, that is it will make arrangements for the reception of the fertilized ovum, that is endometrium will become a spongy bed. All those things, arrangement is happening inside the uterus and that is the function of the uterus. And termination of pregnancy, it expels the uterine contents, that is delivery of the baby. All those things are the main functions of the uterus, that is pregnancy, menstruation, delivery. These are the main functions of the uterus. And the structures which are related to the uterus, anteriorly you can see the uterocervical pouch and the bladder. Bladder is there. Posteriorly a recto-uterine pouch of the Douglas. Laterally broad ligament and uterine fallopian tubes. Superiorly the intestine and inferiorly vagina. And the measurements of the uterus, it is around 7.5 to 8 centimeter length and its width is 5 centimeter and its thickness is 1.25 centimeter and its weight is around 50 to 60 grams. And the parts of the body include, it contains corpus, the body of corpus, fundus, cornua, isthmus, cervix, internal and external os and cervical canal. The layers of the uterus includes, the uterus is having 3 layers, endometrium, myometrium and perimetrium. This endometrium is the inner lining of the uterus. It nourishes the developing embryo and it builds up each month of the pregnancy, and if the fertilization is not occurring, it will shed up during the menstruation. So that regeneration, that is already I have told you that a spongy bed will be forming inside the uterus in order to receive the fertilized ovum, and that bed is forming by the endometrium, and if the pregnancy is not occurring, it will shed off along with the menstruation. And next is myometrium. It's a muscular support of the uterus and it contracts during the childbirth and it allows the passage of the baby or allows the delivery of the baby, and during the menstruation also it helps for the shedding of the endometrium. Next is perimetrium. Perimetrium is a serous membrane that lines outside the uterus. And blood supply to the uterus is by the uterine artery. It's a branch of internal iliac artery, and the venous drainage is by the internal iliac vein. And the lymphatic drainage is by deep and superficial lymph vessels. Nerve supply is by the parasympathetic and sympathetic nerves. And on either side of the uterus, especially at the uterine fundus, from the uterine fundal region of the uterus, we can see one tube-like structure that is known as oviducts or fallopian tubes. It connects the uterus to the ovary. The ovum which is getting released from the ovary will travel through the fallopian tube and it will reach to the uterus. If it is getting fertilized, the fertilization is also occurring from the fallopian tube, and if it is not getting fertilized, it will die within 48 hours and it will get expelled through the menstrual fluid. Anyway, this fallopian tube is acting as a place for fertilization and it allows the passage of the baby, fertilized ovum, and allows the passage of the unfertilized ovum if the fertilization is not occurring. See here, you can see this is the fallopian tube and this small white structure is the ovary. The fallopian tubes are 2 on both sides and it is about 4 to 5 inches in, that is 10 to 13 centimeter length, and it extends from the upper edges of the uterus towards the ovary. It is lined by tiny hair-like projections or cilia. The cilia and the muscles inside the tube propels the egg downward through the tube of the uterus. The egg fertilized, if the ovum is getting fertilized by the sperm, that is also occurring in the fallopian tube. Anyway, the movement of this ovum or fertilized ovum is carried out by the cilia-like projections of the fallopian tube. And the structures related to the fallopian tube includes anterior, posterior and superior, the peritoneal cavity and the intestine. All the areas are covered by the peritoneal cavity and the intestine. Laterally, the side walls of the pelvis is there. Inferior to that, broad ligament and ovaries are there. In the middle of that, uterus is there. It is in the middle of two fallopian tubes. And it's having 5 parts: the intestinal portion, isthmus, ampullary part, infundibular part and intramural part, that is a part which is close to the uterus. This and the other end, which is close to the ovary, is having finger-like projections, that is known as fimbriae, and it releases that fimbriae receives the ovum which is getting released from the ovary. And the blood supply to the fallopian tube is by the uterine and ovarian artery, and venous drainage is by the ovarian vein, and lymphatic drainage is from the ovarian vessels to para-aortic nodes. Nerve supply is from the uterine and ovarian nerves. Now we can move to the ovaries. Ovaries are usually pearl colored, oblong and about the size of a walnut. They are attached to the uterus by the ligaments. In addition to producing female sex hormones, that is its main function, it produces estrogen and progesterone, and it produces mild amount of male sex hormones, and ovaries release ovum. The developing egg cells, oocytes, are contained in the fluid-filled cavities or inside the follicles of the ovary, in the walls of the ovaries. Each follicle contains one oocyte, and these follicles are known as the Graafian follicles, and during the time of ovulation, one Graafian follicles will get matured and it will be released from the ovary. See, this yellow colored structure is the ovary. It is inside, it's very close to the fallopian tube, and when the ovum is getting released, immediately the fimbriated end of the fallopian tube will catch this ovum and it will move through this fallopian tube and it will come to the uterus. And the structures related to the ovary include: anterior to the ovaries are broad ligaments, posterior and intestine is there, laterally fallopian to pelvic ligament is there, and the side wall of the pelvis is there. Superior to the ovary is the uterine tube, and inferior to the ovary is ovarian ligament. It attaches the ovary to the uterus. And it's having medulla and cortex. The medulla is the supporting framework made up of fibrous tissue, and it has ovarian blood vessels, lymphatic and nerve travels through it. And the cortex is the functioning part of the ovary. It contains Graafian follicles or ovarian follicles at different stage. Finally, this Graafian follicle will mature and it will release the ovum. And blood supply to the ovary is by the ovarian and abdominal aorta, and venous drainage is by the ovarian vein. Lymphatic drainage is along the ovarian vessels to para-aortic nodes. Nerve supply is by the ovarian nerve, that is T10 segment. I have told you that one of the main function of the ovary is ovulation. It releases one mature ovum every day and it will enter into the fallopian tube. Around 2 to 3 lakhs of immature ovum will be there in the ovary at the time of birth. Hormones from the pituitary gland makes the ovaries to produce female sex hormones, and this ova will start to mature and it will release one ovum per month at that from the time of puberty onwards. That is, from that time onwards, the female will be getting the menstruation also, if the ovum is not getting fertilized. And ovum can live about 2 days. That is the lifespan of the ovum. It can live about 2 days in the fallopian tube. And if the sperm is entering into the fallopian tube, that is, if sperm is entering, fertilization will occur and conception will occur, and later this fertilized ovum from the fallopian tube, it will move to the uterus, it will get embedded over there and it will start to grow as the fetus. And if the fertilization is not occurring, it will get expelled through the uterus. Unfertilized ovum will get expelled through the uterus. Next is menstruation. It's a process of shedding of the lining of the uterus. Usually it lasts for 4 to 7 days, and sometimes the duration may be shorter than that or maybe longer than that. It depends on the individual, and it is regulated by the female sex hormones, mainly estrogen and progesterone, and around 2 to 3 tablespoons of blood will be losing from the female body during the time of menstruation. So far we have seen the important structures of the external and internal female reproductive organs. Now we can go to the accessory organs, that is mammary glands. The mammary glands are sweat glands specialized for the production of milk. The milk producing secretory cells from the walls of bulb shaped chambers called alveoli that join together with the ducts in grape like fashion to form clusters and called the lobules. That is, this mammary glands, it is clubbed together and it forms an alveoli. From the alveoli, the milk which is getting produced over there will be collected to the duct, and it will forms the entire structure forms the lobules. See, here you can see the structure of the mammary gland or breast. Here this is backside, this is the structure. These are the fat cells, and these are the ductiles, small connections from this lobules, and these are the main ducts. These ducts are coming to the duct opening, and these are acting as the reservoirs. These duct opening are also acting as the reservoirs of breast milk. And these structures, these grape-like structures, already I have told you that these are the mammary gland or alveolus. From here, the breast milk which is produced will be coming through the ducts, and it will be getting expressed to this duct opening. And outside we are having primary areola and secondary areola. That is the pigmented color, and nipple is also there. Numerous lobules assemble to form a lobe. Each breast contains a single mammary gland consisting of 15 to 20 lobes. Lactiferous ducts leading away from the lobes widen into lactiferous sinuses that serve as a temporary reservoir of milk. That is, each of the breast contains 15 to 20 lobes, and these lobes will be connecting together, and it will drain into the lactiferous sinuses, and these lactiferous sinuses stores the milk for a short period. The breast begin to enlarge in females at the onset of puberty. The adipose tissue, the fat tissue, expands the breast, while the suspensory ligaments attached to the underlying fascia provide support to the breast. In non-pregnant females and in males, the glands and ducts are not fully developed. So that's all about the important structures of female reproductive system. We have seen the external and internal genital organs and accessory organs of female reproduction. Thank you for watching this video. Soon we will be meeting with a new video. Till that, bye.